Hi, welcome back to XBP Global Insights podcast, where we explore hyper-automation and how it's reshaping business processes everywhere. I'm Jenny, Global Brand Manager at XBP Global, and I'll be moderating our podcast, which looks at intelligent document processing, what it can do, and how it's reshaping the healthcare sector. So joining me today are three people who know a lot about this topic. We have Alan Pelz-Sharpe, who is founder and principal analyst at Deep Analysis, the renowned independent research, technology research firm. We have Dr. Nita Bhatia, who is our senior vice president at XBP Global, and Sriram Ramanathan, who is our global CTO at XBP Global. So great to have you all for this discussion, and I'm sure it's one that people will have many viewpoints on. So let's kick it off. Welcome, Alan, Nita, and Sriram.
Great to be here.
Thank you.
Great to be here. So, Alan, maybe you could set the scene for us. In your field, you're seeing intelligent document processing as a hot topic amongst analysts and industry. So what's the state of play with IDP today around the world?
Yeah, it's a great question, and to call it a hot topic is almost an understatement. Ironically, it's one that goes under the radar a little bit, despite it being incredibly important. So if I was to roll the clock back, I don't know, 7-8 years ago or whatever, right, I could have probably named the IDP, intelligent document processing, or capture as we would have called it back then, vendors on, well, just a bit less than two hands, right? There'd have been sort of 7, 8, and we'd all have struggled to find more, frankly. Today, we count at Deep Analysis at least 420, 430, and undoubtedly there's more out there. I mean, I'm sure we haven't counted every single one, which is extraordinary when you think about it, right? In under 10 years, we go from less than 10 to over 400. So something's going on. I mean, if I put it this way, in simplest terms possible, whether this is technically correct or not, it's not a bad sort of marker point. People say that 80% of data is unstructured, 20% is structured, structured being the stuff in neat rows and columns in a database, right? Well, if you think about it this way, 80% of the investment has gone into that neat structured data in the past, right? So data warehousing, big data, all these sort of terms got us all excited for what the best part of 20 years. Well, unstructured data, the difficult stuff, the messy stuff, the documents, the scans, the video files, the images, the contracts, whatever, that unstructured stuff. Well, that's what IDP focuses on. And really, sort of with AI, machine learning, and tokens, we could get very technical about what's happened, but a lot's happened. Suddenly, we're at this point where we can actually read and understand what's in these things and make use of them, essentially, right? So that has, I mean, it's an explosion. I mean, it's absolutely enormous. So when you hear people talking about the AI boom, which you can't really avoid at the moment, right? It's everywhere. If you hear people talking about that, if you hear people talking about things like LLMs, large language models, if you hear people talking about agentic AI, well, guess what? IDP is almost certainly involved, and definitely involved in some of those, and almost certainly in others, right? So IDP is essentially that catalyst that unlocks unstructured data and makes it accessible for us to do something with. And so, yeah, it's absolutely incredible. I mean, huge advances have been made, but we also have to be realistic. It's a tough nut to crack, right? Some unstructured data is really, really hard to understand and process. So I wouldn't say this sort of interest is going to wane. Far from it. I think we're in the early stages of anything. We're starting to see this kind of technology get used in places where it was never used or was used very seldom historically. So I think the next 5 to 10 years, it's only going to get bigger if that's possible. So yeah, huge amount of interest with analysts. As I say, we've been covering it Deep Analysis for, well, 10 years essentially from its birth. But just to be clear, and I'll sort of finish on this point, when we talk about document processing, I think there's a perception that, wow, haven't we been doing that for a long time, right? We've been scanning documents and doing stuff. Well, yeah, we have. But the truth is, this is new, right? That this is on a whole other level, right? We can do stuff now that was pretty much literally impossible, you know, just a number of years ago. So yeah, so don't confuse this with, oh, I can scan a document and I can maybe get some text from it. This is on a whole other level, right? We're extracting and processing at an accuracy rate, speed, complexity level that was, as I say, to repeat myself, but I think it's important to repeat, was literally impossible just some years ago. So yeah, very exciting times.
In terms of working in the market at XBP Global, Sriram, have you noticed any particular developments?
Great to be here. And, you know, I just wanted to key off some of the key points that Alan made with respect to IDP and what we're doing, you know, in the space. First off, you know, most of our business across industry, you know, segments, whether it's government or whether it's the finance industry, or certainly whether it's healthcare in the United States and elsewhere, a lot of the work that we do is, in fact, the conversion of unstructured and semi-structured data into a structured format that we then, you know, go and apply a lot of processing rules on, that we apply workflow logic on, and things like that. But recently, you know, what we have put in market is a series of state-of-the-art deep learning models that help us with this conversion process. And while the core of these models is the same, you know, the specific documents that we process in each industry vertical is different. For example, in finance industry, as a horizontal, we process invoices. You know, we're able to convert invoices into all kinds of structured formats, you know, depending on the region that we operate in. In the healthcare space, you know, we take American, you know, HCPA forms, explanation of benefit forms, and then we convert those into EDI and other formats that the processing chain and the payers in the United States can manage. In the case of government documents, for example, as we do in His Majesty's Passport Office in the UK, we convert a lot of birth certificates and old documents into a structured format. And in this case, a lot of the inbound content, it's not just unstructured, but it's in, you know, handwriting. You know, so I think the quality of the AI and the accuracy of the AI becomes super important. You know, as anything else, it's important for this tech to be able to scale, and ours scales. It runs on multiple clouds. In rare cases, it runs in private data centers as well. And we're able to very cost effectively scale our processes and our technology to meet the surging need that we see across many of our customers worldwide. You know, and I think one of the keys here is that it's not just that you have these horizontal models, but you're able to, you know, leverage, you know, newer last mile, last layer training for specific industry and document types, but also increasingly, as Alan pointed out, you know, leverage LLMs, you know, for content that we haven't seen before. So we're able to, you know, without training, be able to get success in multiple niche use cases.
Let's take a look at healthcare then, for example, and maybe this patient's viewpoint, say the healthcare worker, and thinking about IDP and the difference it can make there. What would you say is the sort of state of play in healthcare, Nita?
Thank you, Jenny. Well, when it comes to the healthcare, I think there is no other industry like us, which is like a land of living contradictions. I mean, just think of it. I think this is the only industry where a patient can today get a robotic surgery from a surgeon who's remotely located some other part of the world, and at the same time, in the very same hospital, you walk down a few steps and you will hear the comforting screech of this fax machine, right, spitting out some insurance forms. That is how reality is today. I mean, there's incredible innovation on one hand, and at the same side, you know, there's going to be this stubborn attachment kind of, you know, to papers, to clipboards, right? And honestly, you can feel both the mess and the magic at the front desk. I mean, you come to it, when you think of it from a manual patient onboarding, I think it takes about 40 to 60% of staff effort is today going beyond patient onboarding at the point, right? As a patient, now if I have to think of it as a patient, before you reach to any part of that, the medical science that we were just talking to, you have to be waiting in endless queues. After that, you're handed a clipboard. You're asked to fill out mountains of paperwork, repeated forms, show your insurance card maybe twice, thrice. And it's no wonder sometimes the patients are actually wondering if there's anyone in charge of this circus at all, right? I mean, it's easy to smile about it, right? But honestly, it's exhausting for the staff and also for every patient through this ordeal, right? Just trying to get into the door there. And that's the reason why I get so passionate about IDP, where I believe with intelligent document processing. Imagine this: you can check in with your phone or your tablet from home. I mean, from the couch. You can be in your car, take a photo of your insurance card, and watch how your information is getting validated in real time. There is no spelling errors. You're not repeating your name again and again. No lost forms. No anxious waiting time. Consent forms signed electronically and stored in one place, easy, safe, ready for any person, any doctor, any staff in the hospital to pull it up in seconds, right? Not hours, right? You're not doing the same thing again and again. What more, I think this information is again instantly available in the right place, right? So staff can just stop being traffic cops for that's how I look at it essentially, and then start being the patient guides and the patient advocates that they're actually meant for, right? And, make the care journey as smooth as it is supposed to be originally.
So Nita, you've already touched on it to some degree, but how does IDP actually sort of fix this in sort of practical ways? Is this something that's still to come, or is this something we're actually doing now in organizations?
From a pain points, right? I mean, yeah, we've covered some part of it. It's not just these visible hassles, Alan, essentially, right, for patients or the front desk does. Beneath these, I think there are some more deep-seated technical and business challenges that also need to be taken care of. For example, the real issues often start with the fragmented data environs that we are in today. The patient information is scattered between legacy HRs, you've got siloed registration tools, and then scanned insurance documents that are not easily accessible or searchable, maybe. So this lack of integration essentially means that manual data entry is still required at almost every step. And with every manual touch, you have an increased risk for error. Compliance exposures are also increasing, right? And these problems also have downstream effects. Errors or maybe omissions essentially in insurance data, in demographic data during this onboarding time can lead to claim denials. It's going to increase and lengthen your revenue cycle time. And ultimately, all of this is going to contribute to increase in your AR days. So I think by as much as about 20% is what I read last in US hospitals in 2025. So missing consent forms, misfiled consent forms, misfiled insurance validation, it can lead to other aspects as well, right? And then audit scrutiny, all of it coming in. This is where I think IDP makes a strategic difference. It will deliver automation at source, capturing, extracting, validating, and then integrating the information from diverse documents directly into the systems of records, the billing systems. You can flag inconsistencies immediately, reduce the data entry time, and then also ensure that every critical document is indexed, is retrievable, right? So kind of you're making onboarding into more of a strength, an operational strength, and not a risk process. You get what I mean? So faster reimbursements, also fewer errors down the line, improved compliance. Staff is also maybe smiling a bit more at my patients.
Yeah, interesting you mentioned that aspect of it, the claims processing. It's not just onboarding. There is the potential for this IDP to cover a whole lot of other areas, with claims processing being a very important one when you look at the numbers and the costs behind that. So Alan, based on your experience, why is that sort of thing still so manual even today?
Well, we've already touched on it to some degree. I mean, a lot of it is to do with silos, right? Everybody's on a different system, and even within one facility, there's multiple different systems. They don't talk to one another. So, I mean, there's a lot of sort of historic legacy and actually cultural challenges here, but I think this is where it gets exciting. So if we talk about, like, again, we've already touched on it, but sort of claims processing, right? So we've had systems, we call them case management systems for a long time now, right? Which are, and I'm probably insulting people in the case management world here unintentionally, right? But ultimately they're smart folders, right? This is a claim, and everything in that claim belongs in this place, and and I can work on it and then pass it on to somebody else. So we've always sort of had that, but as we've already talked about a few times here, most of that's manual, right? It's like, oh, do I have this? Was it in my email folder? Did somebody send it to me, etc., right? So we have the potential now to automate, maybe not all of it, but a lot of it. Yeah, we've got the potential now to automate so much of that, and not just, oh, this I've captured, oh, it relates to this case, therefore it goes into this case, which relates to this claim. Actually, we can go way beyond that. We can basically say, is something missing? Has it been signed properly? Does it actually have the right date on it? You know what I mean? We can do so much of this validation, which today is manual. In almost every case, it's manual. So listen, there's no magic wand, and nobody should claim there is, right? I mean, the challenges today, I say this a lot, and I think people sort of not convinced that I'm telling the truth, but there's nothing wrong with the AI. The AI works, right? So the IDP in AI, which IDP, Intelligent Document Processes, is indeed predicated on the use of artificial intelligence, machine learning. That works. Where there's problems is in the data. Where there's problems is in the not understanding your business processes. Where there's problems is not having access to various things, right? So these are issues though that can be resolved. The fact is we have something now that has the potential to really allow us to rethink, reframe, if you like, reimagine how we go about some of these critical business processes. And I think, again, I'll repeat myself, I think the biggest challenge today is culture. We've always done it this way. Oh, I'm not sure about this. Oh, it's all very new. Is it risky? Is it? Here's the thing. No, it's not, right? You're already making mistakes. Nita's already pointed to it. Every time a human is involved, you're actually guaranteeing, never mind introducing the potential, you're actually guaranteed there's going to be manual key entry mistakes, right? You can actually guarantee that you will reduce that if you start automating it, right? Because AI is actually better. So there's a lot of things going on here, but yeah, maybe I'll just finish on this part here. I mean, one of the biggest challenges, particularly in healthcare, is the lack of standardized forms, the lack of standardized documents. They are all over the place, right? Everybody has their own version of it. And that seems like an insurmountable problem to tackle. It's not. Again, I just want to be honest and open. There's no magic wand. You can't automate everything overnight. It's just not true, right? But you can potentially automate 60, 70% of it. And when you think about what impact that would have on your operation, that is absolutely amazing. So, yeah, I mean, there's a lot going on. It's very messy, but that makes it a great opportunity to clean up, frankly. I don't know, maybe Sriram, do you have some thoughts on this?
Absolutely. Thank you, Alan. I think you made some very important points that I wanted to, just bolster with some actual data, in terms of how we're doing this. Look, I think it's important to mention that the reason that we've made these investments in IDP is primarily to offer much better SLAs and outcomes for our customers, save millions of dollars in the way that we operate, pivoting from exclusively using humans to leveraging, a lot of technology via these neural networks that we have, and continuing to have HITL, human in the loop, so that when you have, this type of unstructured to structured conversion, you still have humans to verify that things are being done the right way. And most recently, our investments in agentic AI that further, help the humans be more productive and be more cost effective in the way that we, deliver, high quality services worldwide across each one of these. And so in many sense, what's going on with how we're leveraging, AI as well as agentic AI, using all of these LLMs is just to, leverage the state of the art to bring better outcomes to all of our customers worldwide. And it's an imperative, it's something we have to do, and it's something we are doing, and it's something that we've measured gives us, the better outcomes that Alan was talking about, and making us more efficient in what we do.
And Nita, so in the IDP, say, claims workflow process, right? Where do you think the biggest impact will be?
So when I think of claims processing and IDP, I'd say the pain is shared by both hospitals and payers equally, but in different ways. Yeah, I mean, that's how I would say. For hospitals, I think the challenge is getting reimbursed quickly and accurately. Every month, they are submitting millions of claims, often as messy combinations of scanned PDF, EOBs, handwritten notes. So manual review means a slow turnaround and high error rate. We just touched on that. On the other side, the payers, they've got their own set of challenges. And like you mentioned, they already have these same non-standard claims coming in. So you've got backlogs, you've got slow adjudication. So inconsistent decisions, inconsistent adjudication as well at points. Right? So where IDP comes in, it's going to transform the workflow on both sides. For providers, it can automate the extraction and validation of key fields like CPD codes, dates, patient ID, payment information, dramatically cutting errors, and accelerating the submission to payment kind of a timeline. Yeah. On the payer side, IDP can mean maybe faster claim intake, more consistent adjudication, if I can call it that. So whether you're running a hospital or a payer organization, I think IDP is breaking down bottlenecks and delivering operational efficiency, definitely, on both sides of the table.
Yeah, and I think what's just as a sort of validation point here that we're not talking about fantasy technology, right? The fact is, this exact same stuff is being deployed elsewhere in other industries. Yeah, I mean, we're seeing actually globally, we're seeing a huge uptake in the use of IDP technology in supply chain, for example. Now, supply chain and healthcare may sound like they have nothing to do with one another, but the reality is actually at a paperwork level, they're quite similar, right? You have a lot of paperwork relating to a shipment. Some of it's very, very messy. Some of it's got coffee stains on, some of it's handwritten, whatever, right? But it all has to be very, very accurately processed. And so we're seeing a lot happening in supply chain. Also in government claims, right? Be that a pension claim, for example, right? Or some kind of supplementary benefit or something. There's a huge amount going on there. And I don't have sort of scientific or sort of credible and solid data to share, because none of it, there isn't any, is the truth of it, right? But anecdotally, what we are seeing is something in the region of sort of 50 to 60% in these sort of processing environments becoming what we call straight-through processing. In other words, everything checked out. There's no reason for a human to check it. Let's just get the job done. And 50 to 60% maybe isn't as exciting as 99%, right? But if you're handling, as you said, millions of things a day, and suddenly you're only having to manually handle half of that, and you're not actually doing all of the work on half of that, right? I mean, we're just talking about a completely transformed operation here. So yeah, this is happening. It's out there. It's already being deployed in other sectors. Healthcare is absolutely the next big one. I don't think that's anybody's doubting that. And so that scalability issue, that's not really the problem, if that makes sense. AI can scale. We know we can handle large volumes. And again, this will depend from organization to organization, project to project, but the reality is the costs are really inviting as well, right? You can potentially reduce the cost of processing an enormous amount of, as we've been talking about here, claims. We can reduce that cost and increase the volume, which is a sort of interesting situation, because it's always been the other way around, right? More costs more. And now we're talking about more costing actually less. So yeah, exciting times.
And also, if I might add here, Alan, is how regulation and policy are also quietly but powerfully shaping this entire landscape here, right? If you look at the 21st Century Cures Act, which is pushing interoperability, the CMS guidelines around audit trails, data transparency, it's a clear mandate. Secure, intelligent document automation is no longer a nice to have. It's going to be essential infrastructure, I believe. So for leaders in the healthcare space, I think it would mean choosing IDP systems, keeping in mind compliance, documentation. You would need anyone who's embedding compliance into their digital workflows now is going to be avoiding risks maybe sometime down the line.
And Sriram, looking at scalability, how does that look for large payers that might be handling millions of claims every year?
When I think about scalability, Jenny, I look at multiple aspects. One is obviously, can I scale the core technology? Am I running, for example, on Kubernetes? Am I running on cloud providers? Okay, is the technology flexible enough so that it can run on public cloud, hybrid cloud, or a private cloud? And what we're doing from a technology perspective so that scaling is automatic. I detect how much volume I'm getting, and I auto scale to meet that volume, so that I'm not using too many resources. I'm able to maintain latency and throughput and get cost effective technology based scalability. But when I also think about scalability, I'm also thinking about the humans in the loop, how we're scaling them. For example, we've got our own keying outsource model where we rely on freelancers, and we do the same thing there. We engage as many of them as we need. When we shard a document and send it to different places to key errors in that the AI cannot recognize, how does that scale? And what is the technology we've put there to keep the human in the loops, and scale that part of the operation? And finally, I think you always have to think about security. Are you managing things right? Do you have the right type of AI? Is it built the right way? Is it delivering the right results? Is it secure? Do you have the audit trails to checkpoint what you're doing, how these models have been built? Checkpoint the types of capabilities that we're actually rolling out to customers, and have governance around that. I think that's also a valuable aspect of scalability that we think about when we roll these technologies out worldwide.
Sounds good. Okay. So if I'm looking ahead then, how will IDP, and this is a question for everybody, shape the global healthcare experience looking over the next 5 years, say, starting with you, Nita?
From a global perspective, well, I think the way we understand this, looking at, I think IDP is going to be more about more than swapping paper for PDF. I think it's going to be about reimagining the entire healthcare journey from end to end. You remember the contrast I mentioned, the high-tech surgeries versus the noisy fax machines, right? I mean, IDP kind of connects these two worlds by making workflows more smarter, more faster, from onboarding right all the way through clinical documentation and billing, right? I think we are moving towards a future where I see onboarding being fully automated, self-serve, accessible anytime, anywhere via mobile or web portals. Patients can check in anytime, anywhere, whether they're on their couch or on the go. With you have AI-driven identity verification, think face matching, document matching, plus real-time insurance eligibility checks. I think maybe I'm asking for the moon, but we are getting there. I think we are getting there, and onboarding essentially will be seamless, right? All alongside this, if you have maybe tighter integrations with telehealth, remote care, I think it means less in-person paperwork and more patient-centric omni-channel experience. I think essentially what we are saying is it's not just about going paperless, it's about putting this patient back in the center of their own care journey. I think that's where we are.
Sriram, do you have any thoughts on that?
Absolutely. I think when I think about being global, a couple of key points, I think come to mind. First is, from a core technology perspective, you have to be able to operate globally. That means you understand different languages. Our models understand German. Our models understand French. Our models obviously understand, English, multiple Indian languages. You have to be able to operate in locale. You have to be able to operate in a model where you're able to understand, different sets of documents, regardless of the language that's being used. So that's one part of being global. The second is, how the human in the loops are distributed. So we've got global delivery centers where a lot of, data that we process remains local. For example, when we operate in Europe, we're GDPR compliant, which means that we adhere to the core principles of GDPR in the way that we run and operate the business and the outcomes that we deliver. We also are compliant with a lot of standards there, like DORA. We're compliant with the EU AI Act. We comply with all of the restrictions of those apps. So, our models are global in that respect. And finally, it's the global governance of all of this, right? Having common development teams that are able to scale 24/7, operate around the clock, and be able to improve, the throughput and efficiency with which we both deliver, deploy, and manage technology.
Alan, have you any thoughts on that? Thinking even examples from other sectors?
Yeah, I mean, I think the thing we're trying to stress here, and rightly so, is this is a journey, right? We have the technology now. Those breakthroughs have come. The technology works, right? So let's be clear about this. There's a lot of AI which you might encounter in the consumer world that you might have big questions about as to whether it works particularly well, and you'd be right to do so, right? In the enterprise, in the business where we're talking about very specialized, very highly trained, very specific things, the technology works. That's a whole different ballgame. But we are on a journey, right? I mentioned earlier that, there's sort of two big aspects to this. One is the quality of the data, because like anything, if the data is not good, then the outcome's not going to be good. That's a given. And secondly, do you understand your processes and the tasks involved in those processes? So those are sort of easy questions to ask, right? Have you got good data? Do you understand your processes? In reality, they're actually quite hard questions to answer. Yeah. So this is a journey. It takes time. There's no real magic here. But the question was, I believe, was sort of over the next 5 years. I think there's going to be a huge transformation over the next 5 years. I really do. But healthcare, quite rightly, is risk averse. And thank goodness it is, right? We all want that. That's okay. That's okay. So I think what's going to happen in the next 5 years, I think we're going to find what we might call low-hanging fruit, right? We're going to find areas where, look, this needs to be improved. We can improve this. Let's get that going. So it's sort of like a snowball effect. We start on things, we improve those. And I think it was Nita who said it. It's a very good point. Once you start something, it sort of rolls in, right? So if you're now getting cleaner data, well, guess what? We can do more with that data than we could before. It's not just an image coming up on somebody's screen that they're then going to hand code something into another screen, right? Now we can actually do something. So we're setting the foundations over the next 2 or 3 years of really good data and starting to really understand the process that we can improve. So it's very exciting. And yes, that's happening in other industries. I mentioned supply chain, I mentioned government. There's lots of other examples. I pull those two out, particularly because similar to healthcare, they've been very paper bound for a very, very long time. Yeah. So they're going through that same evolution, if we can call it that. And I would finally just say that no shame and possibly an awful lot of fame in actually looking at those. If you're in healthcare, look at what they're doing in supply chain. Look at what they're doing in government, right? Because when we break it down at a technology level, it's really messy paperwork that needs to be processed really accurately. So there's lessons to be learned across industries here.
So Sriram, then when you're looking at a global organization like XBP Global, how would an organization like that play a role in a transformation like this in making it happen faster?
I mean, that's a fantastic question, Jenny. I mean, the way I look at it is this is what we do. We're an intelligent, workflow automation company that infuses AI into everything that we do, so that we can deliver, outcomes that are best in class, for all of our customers globally. And the way that we do that is we have these models, and these models work across all of the domains that we participate in, that we cater to across the ecosystem, whether it's healthcare. Certainly healthcare is the focus here, or financial services, or the other industries like government that Alan was referencing, that we heavily cater to both in Europe as well as in America. And orchestrating this workflow using agentic AI is a big piece of where we're headed today. If you look at our internal agentic AI program, key portions of the workflow leverage, what I'm calling traditional AI. Key portions of the workflow reference, LLM-like technology that allow humans to be far more productive than they are. And key elements of the workflow involve humans in the loop to make sure that things are actually being done right. But when we do this all in harmony, it allows us to not just, talk about AI, but to talk about how we're leveraging, the full spectrum of technologies that we have to deliver higher quality, best-in-class outcomes for our clients.
Nita, have you any thoughts on that?
Oh, sure. I'd love to add this. I mean, coming from the domain here at XBP, we understand that healthcare's complexity demands more than just advanced technology, right? It requires deep domain expertise, besides the scalable solutions, which are tailored to real world workflows now. We bring in decades of experience in RCM, medical coding, claim automation. We've pioneered autonomous coding as well, right? So XBP brings in this unique blend of cutting edge AI and industry knowledge to drive transformation for providers and payers worldwide. Again, I keep saying that we don't simply digitize documents. We are helping organizations break down these fragmented data silos, streamline their revenue cycles, reduce errors, and ultimately deliver better patient experiences, right? In an industry that is still weighed down by manual paper-based systems, I think IDP powered by XBP will be this critical enabler for operational resilience throughout, right? And we're proud to lead this charge towards building a more intelligent, connected, efficient healthcare world.
Thank you. That's a nice note to close our discussion on. Thanks to all our speakers today. Great, very interesting topic, and I think really interesting insights. And to our listeners, thanks for tuning into XBP Global Insights. And if you'd like to learn more about intelligent document processing and how it's redefining operations in healthcare or in other areas, just visit XBP Global and connect to one of our team. So thank you everybody once again, and until our next podcast, we'll see you the next time.